has to be given only by that specialty, and you are not supposed to charge for that certificate. Life certificate is very, very important, and that is only valid for 12 months. So you need to be careful in providing a certificate of fitness for working in ships and all these things.
Among the certificates which you have mentioned, in your experience, which are all you think are very sensitive in terms of they have more legal liabilities? I will name the list of certificates. Can you please tell us the best practices as well as important considerations while issuing the certificate?
That you can't give a death certificate. You can only say that I can give the person is brought dead at this point of time. That doesn't allow them to go for any burial or for any other formalities. These certificates are to be issued in original and has to be submitted to the appropriate authority. No duplicates can be used for any other purpose. It's in Form 4A, death at home, that has to be provided there.
Is there any restriction for the number of days, maximum number of days for a doctor to give?
28 days, that's 4 weeks.
The doctor's given medical certificate inappropriately and got into problems. Do you remember any stories like that?
Hello doctors and medical students, welcome to our second podcast and thank you for all the support. Our doctors community creating a lot of discussion, a lot of content on academic aspects, but we are lagging behind to create discussion and content on other aspects of life as a doctor in this society. That's what exactly we are going to do in this platform. If you are not following it till now, do it right now. We are going to learn a lot from this platform. In every episode, we are going to discuss one important topic which will be very useful for the doctors. In this regard, today we are going to discuss about medical certification. Nobody can deny that medical certification is integral part of our medical practice, but many doctors do not have adequate knowledge regarding medical certification. There are so much to be discussed regarding medical certification. Many of us do not know the essentials, rules and regulations involved and do's and don'ts regarding medical certification. So I feel it is imperative to create comprehensive content on medical certification. For that, today we are with none other than Dr. T.N.R. Ravishankar, one of the leading medico-legal experts in India.
Thank you.
Sir, what are the common reasons people come to us for medical certification?
The general need of the public is based on two major things. One is for their ailment. They have a problem, they come to a doctor for treatment, so they need to avail a medical leave for their benefits in the workplace to continue, or if they are studying in school or college, they don't need to lose any attendance. That's the first reason they might be asking for a certificate. The next one is for their professional work or an occupation, trying to get an employment. At that point of time, they always reach a doctor to get a certificate of physical fitness or mental fitness. These are the two major places where a patient comes to a doctor to demanding a certificate. They avail a leave for the ailment they suffer. They have to be given a document by the treating doctor for what ailment, from which date to which date the individual was sick and was under treatment and needed rest for those days, and from which day the individual will be able to come back to normal work. That's a major certificate that is being issued by any medical practitioner in this country or in fact any part of the world. The next one is somebody goes for a employment for the first time, or they are getting changed in their employment, and every employer demands the certificate of physical fitness or a mental fitness. It depends on his nature of job. If it is going to be a physical work, manual labor, they might have to give a certificate that he is physically fit for it, the job. He should not be suffering from any non-communicable diseases if he is of young age, and if he is of a higher age, somebody who is 45, 50, they might ask him that he doesn't have a complications of the non-communicable disease, and that's the one major thing. Somebody is working in an IT industry. He is not supposed to have a drug which he needs to take for keeping some of his systems normal, like an epileptic patient who needs to take rest for 8 hours. He can't do a night shift. He can do a night shift at the same time. He need to compensate equally in the daytime when he has to sleep at least 8 hours. These are things demanded from people where they need to spend their brain and work for hours together thinking around, and those people, they are always asked to give a medical certificate of mental fitness and physical fitness. These are the two places where the doctors are majority asked for to give a provider certificate. And there is another major issue is that disability certificate. That has to be provided only by the concerned specialist and not a general practitioner or a family physician, or anybody cannot provide that. As such, it depends on the disability where he has got. If it is going to be an eye disability, it has to be provided by an eye specialist or an ophthalmologist. And if he has got a fracture and has got a difficulty in walking or a spine deformity, it has to be provided either by an orthopedic surgeon or a neurologist who can certify his neurological deficit. These are disability certificates. These are major places where the registered medical practitioner is being asked to provide certificates.
Okay, sir. And I think I heard some, because I also came across these kind of certificates, like they are coming for life certificate, like when they're, usually it happens when there is a property transfer, something like that. At the time they're asking for life certificate. Is that also like, what is significance there for us?
There are two places where the life certificate is demanded. One is when there somebody is going to try to register a property to somebody to sell it or buy it, or that place they always has to give a life certificate, or the person is alive on that day. Usually somebody who's sick, the registrar of the register office is asked to go to their house to register the property which is available in this country as per the constitution and the law that is prevailing in the respective states. In those places, they need to give a certificate, life certificate. The person is also disabled, cannot move out, old age person, bedridden or somebody like that. So at that point of time, they also demand a certificate. The life certificate is another place where people live for ages beyond 70, 75. They are a retired person, or the spouse who's eligible to receive the retirement benefit of pension, monthly pension, and somebody who's there to get back the insurance money that he has paid. These are the situations where a life certificate is demanded by a patient from a registered medical practitioner. It's very simple. Verify the individual. Today you have your Aadhaar card. Earlier it was only the passport, and passport was not available with all the individuals in the country. Now Aadhaar card is available with every individual. Verify with your Aadhaar card, certify that person is so and so. And very important is to add the identification mark of the individual and give a certificate. Life certificate is very, very important, and that is only valid for 12 months. Usually it is valid only for 12 months. The time usually happens at the beginning of the financial year or the second half of the financial year. The institutions, the banking sectors will be demanding the life certificate, and also the workplace that provides pension for individuals also will demand a life certificate for that.
Okay. And among the certificates which you have mentioned, in your experience, which are all you think are very sensitive in terms of they have more legal liabilities?
The legal liabilities is more on the life certificate.
Okay.
There are times when we did not have the Aadhaar card.
Mm-hmm.
Hardly 10 to 20% of the population was having the passport.
Mm-hmm.
I don't think every individual is going out of the country and they were getting the passport. Today, everybody owns a passport.
Mm-hmm.
At that point of time, it was always difficult to verify the individual. There were only the ration card provided by the state government, which doesn't have the identity of the individual, and there is nowhere that the identity of the individual is being marked on the ration card. And that was a very, very sensitive issue, trying to give a life certificate. There are a number of doctors who landed up in trouble with the courts directing the medical council to take action against them for having provided a false certificate, which was not an intentional false certificate, but somehow they got entangled into such an issue, and that is where the whole problem had happened for those individuals. This is a very, very sensitive one. Even a leave certificate, somebody who demands it regularly to get away from the workplace. Today there is another issue also that they want to do work from home.
Yes,
the
I was supposed to ask that.
Yeah, the work from home is another certificate which is being demanded by the IT industry people or somebody who's working on shifts. We need to justify in some way or other whether the person needs to be exempted from a regular duty or from a shift duty, and that has to be also mentioned on a specific time. Beyond that time, I think it is unfair to get the leverage of the individual's capacity to work in an institution. So you need to be careful in providing a certificate of fitness for working in shifts and all these things.
Yes, sir. Actually, usually we face problems when if the person is a regular patient, we have a dilemma like how to handle the situation. Do you have any best practice on that? So like how to handle, and he's a regular patient and his family itself, they are regular patients, and we actually feel like pressurized to give the certificate. So how you handle in your experience?
That's law is law.
Okay.
There is no excuse for law in the society that you know the family well or you are a VIP or whatever it is. If the law is there for the certain things, it has to be maintained, it has to be followed, strictly adhered, and that too, as a professional, you have the obligation that you have to maintain it. Yes, it is very difficult. That too, if you are a family practitioner like me or any family practitioner will have the difficulty refusing to oblige for your patient's request. But then you need to explain to them that giving that such a certificate is going to risk him from losing this family physician because of the law. It can be enforced against an individual for having given a false certificate or a wrong certificate or a fabricated certificate. These are under the law penalized. Any certificate is a legal document. As a professional, not only the medical professional, even the legal professional, architects, take for that instant the priest. If the priest is also giving a birth certificate or a death certificate to somebody who's there within their religious thing, it is also a legal binding certificate. When the law is existing in the country to give a guideline for it, as an individual, as a citizen of the country, it is our duty to follow it. And so, obliging for somebody who's known to you or even to your own family member, it is unfair. It is called unfair trade practice, where the National Medical Commission has got certain amount of penalties and punishments for it. And that is not fair, and you have to face the law. You need to tell the patient if they are demanding a leave certificate of an undue extension or a certificate which doesn't, a life certificate with a person sitting at home. And today, when somebody wants a life certificate and a patient is sitting at home, you can always use your mobile. You have your internets, you have your digital media. You can always talk to them, clarify with them, and try to give. And based on the conversation with an individual, you can always say it in the certificate that based on the individual was not present physically but being verified on the virtual mode, that the certificate is being issued. This is legally valid and legally can defend you from your lawful activity.
I think this is a very, very important aspect of that medical certificate which you have said right now. I think you also rightly mentioned any certificate is a legal document because we also give our registration number and everything, our whole details will be there in that certificate. Okay, so next, I would like to ask, like, apart from patient asking for certificate, what are the legal obligations for a doctor to give certificate? Like, they must give certificate. Something, any situation like that is there?
Yes, your birth and death certificate. The two major certificates where it's a legal obligation. Somebody is born in a nursing home. As an obstetrician, you have delivered a baby. It is your impounded duty to inform the local authority of the birth of the child within 21 days. That is without fine. If it is beyond 21 days, you need to pay a penalty to the local authority and then inform them the birth of a child. That's an obligation. The same way, a death also has to be informed within 21 days to the local authority so that it has been registered. The Indian statistical data has to be there, and that the birth and death register is an obligation on a part of any medical practitioner to issue for wherever he had delivered or wherever he has seen a death happening. And it is very important that these two certificates are not charged by the medical practitioner for the services that they are providing. It's a legal obligation. The National Medical Commission's Code of Ethics also clearly says that we cannot charge for a birth and death certificate. Somebody who has conceived pregnancy 58 days plus, you have a stillbirth or missed abortion, also need to be informed to the local authority. 58 days plus of consumption, and you lose the child intrauterine, it also need to be informed as a stillbirth or a missed abortion or whatever it is to the local authority.
I think, sir, you also mentioned like we can refuse in some terms. If this is not correct, we can refuse to give certificate. But I want to ascertain that. Can we refuse it?
If you find legally it is not correct, you have to refuse it. First point. Somebody has got an enteric fever. Enteric fever demanded 21 days of rest 3 decades ago. But today, anybody is busy, anybody is recovering, rehabilitating within 3 to 7 days. Somebody demands 30 days of leave for a simple enteric fever where he wants to enjoy the holiday that he has got in the company or the workplace. Then you can always refuse. You can say you can take a holiday for a week, 10 days and then go back to work and refuse it. That's a clear-cut The amount of holiday, the amount of time needed to recoup back to work can be decided by a medical fraternity. And he can always say, 7 days I will give you. If you're still not comfortable, I can give you for another 7 days. He has to keep giving certificates. Not more than 4 weeks. At a given point of time, you can give a certificate. It always goes to the medical board later. If it goes 3 such occasions, 4 weeks, and 3 times beyond that, it's always referred to the medical board. And if the medical board files it wrong, that you had given an extended holiday for a leave that it doesn't deserve, then they can always refer to the medical council to take action against you. That's a major issue in a leave certificate. Death certificate is one where you have to witness the death, or you should have treated the patient at least 7 to 14 days prior to that, and the reason for the death and the history enumerated should be coinciding with the ailment that the patient is suffering. Somebody 18 years or 20 years suddenly brought into your clinic and brought dead, you are not obliged to give a death certificate. At that point of time, your duty is to report to the nearest police station or tell them that you can't give a death certificate. You can only say that I can give the person is brought dead at this point of time. That doesn't allow them to go for any burial or for any other formalities. They need to go to the nearest government hospital for an autopsy or a postmortem, depending on the situation, and then only then can get a death certificate. These are 2 major areas where giving a death certificate is a very, very complicated issue, and today public is aware of it. When they find somebody sick at home, they always call the nearby doctor to come and witness them and treat them, so that they have the easiness to get a death certificate at a later date. This is what death certificate and leave certificate with an unreasonable point of time is always a problem for any medical practitioner. And if some courts or a statutory body finds it wrong or violating or unethical, can always refer to the respective state medical councils to take action, and that action will be debarring you temporarily or permanently, which is very bad for any medical practitioner.
Regarding certificate formats, in our practice we encounter that people usually sometimes they come with their own format. Do you have any suggestions on formatting the right draft of the medical certificate for different kind of certificates?
Your National Medical Commission has added all these things as an appendix and given it. What it always needs is the identity of the individual, the appropriate name of the individual along with the initials if they have, or their family name, the sex of the individual, the age of the individual. All these things can be correlated along with the Aadhaar card. It is now important that the Aadhaar card number is also entered into any of the certificates, so that the individual is clear-cutly known, this is such and such a person. And another 2 important factor is 2 identification mark of the individual will have to be there in all the certificates, be it leave, fitness, whatever it is. The 2 marks of individuals to identify them, either a mole or an injury mark or a scar mark or a surgical scar, will have to be there. Today it's mandatory that you have the identity of the individuals, and then you write down what is the reason why the certificate is issued. If they are getting a certificate of life certificate, they can always say the certificate is issued for which purpose. A certificate for registration purpose, a certificate for availing the pension, certificate for using for banking sector and all these things. These certificates are to be issued in original and has to be submitted to the appropriate authority. No duplicates can be used for any other purpose. Even when you are trying to issue a death certificate, any individual goes to the local authority and try to get 7, 10, 20 copies of original death certificate to be used at different places. Any bank will only demand an original death certificate from the local authority. The same way, the certificates of this nature to be issued by a doctor cannot be in duplicate and has to be used at only specific place. If it is for bank alone. If it is for register office. If for workplace, it has to be at workplace.
We have to mention in that certificate.
For what reason the certificate is being issued has to be mentioned very appropriately, so that any other concern, any other establishment doesn't misuse a certificate for any other reason. It can be either misused by the individual or can be misused by the establishment for their own benefits. In that situation, I think the clear cut why the certificate is issued, on which day and date. The date is very, very important, and the time is also very important these days. Anything can happen within 1 minute or 5 minutes or 10 hours. And so it's very important that you have your date, day, time, and year along with the certificate at all times.
So now I will name the list of certificates. Can you please tell us the best practices as well as important considerations while issuing the certificate?
Important
Considerations as well as...
considerations.
Yeah.
Okay.
Number one, leave certificate for students.
Students, it's a very easy one. The only thing is the schools are misusing the medical fraternity. Like
For
a
everything
professional, like a office, they are eligible for 21 days. Even if the grandmother dies at home, every parent will come and ask you a leave certificate saying that the child was sick. It's the right on the part of the family member to light and give it that because of the grandmother's death or grandfather's demise that the child required 3 days of holiday. And why should they come to a medical fraternity? That it's a one that is there. Any director of school education in any states in this country has given the provision of 21 days and beyond that also as a eligible leave that a child can take when they are coming in a single academic year, which always the schools will demand. And it is very easy that this is the situation where we always oblige to the parents giving a leave certificate. 3 days, 5 days, 7 days, it's okay. There are children who have some psychiatric ailments and at that point of time might demand it for a longer time. At that point of time, it is right on the part of a family practitioner to request a psychiatrist to give a certificate of that nature, because this psychiatrist certificate will help the child in one way or other to pass over or tide over the standards. The academic year, they can change over on the academic year. There are times when a general practitioner certificate will not be valid if it is being challenged by anybody else in the court of law, or if it is being challenged in the school health department and all these things. And for giving a certificate for school, we always are too leisure, lethargic, or we don't take it too seriously, but that also can create problem. Something in the family, a marriage or anything, you can always refuse, telling the parents to write and give it because of the marriage sequence and family they have taken leave. As a medical practitioner, let's be very fair, very straight, being within the legal framework, whoever they are. Let's follow the law that is existing in the country.
Sir, in my experience, I've seen parents asking for medical certificate for 1 or 2 days for LKG or first year students.
This is only to try to escape answering the headmasters that giving a certificate by us, it makes it easy for them.
Next, medical leave certificate for employees.
It has to be very, very careful. We have already told about it. Specific dates, if for the depending on the ailment, how long the individual might take to recoup from the ailment. Some will take 3 or 4 days. Some will take a week's time. Some will take more than a week's time. Depending on it, at a given point of time, don't try to give it more than 7 days or 14 days. As usual, everybody will come for 30 days. No. A general practitioner can give it only for 30 days, or a physician can give it only for 30 days. If it is beyond 30 days, it has to be authorized by a government doctor working in service. That only will be more valid. Because of trying to go to a government hospital and trying to get it difficulty, they always come to the nearby family physician or a physician to give leave for more than 30 days. Give it for 7 days or give it for 14 days and then ask them to come back, assess them and then try to give it or extend it. Or you can give a fitness certificate that you have to join on that particular day. Beyond that, I don't think the patient is going to come and nag you to get a false certificate.
Okay, sir. Next one, fitness certificate for driving. Renewing driving license.
Yes, 2 major things has to be, sir. The visual acuity and the color vision is the 2 things that has to be there. Even a disability can always be added. What is the disability they have? It depends on the inspectors who are assessing them whether they can drive the vehicle, whether they can use the clutch plate or all whatever it is. All depends on them. But what is a disability? You can always mention it. You have to check it with the Sneller's chart whether the color vision is proper or not. And driving license. After 60, it has to be renewed every 5 years. That has to be very, very careful. When you are trying to give a driving license certificate, then it means that you are allowing a person to drive on the road and every other person is safe and that person is driving on the road. That has to be there, and the age has to be really designed. Trying to give a certificate for an younger person to drive, allowing that person to misuse the road, is going to give harm to a lot of populations who are there using the road, and you need to be very careful when you are trying to give a driving license certificate fitness. It is very important to add the exact correct group of the individual in the driving license, because something happens on the road, this license is going to help him for the other people, to help him out if he is in need, a dire need of a blood. At that point of time, trying to find out what is his blood group, or if you had written a wrong blood group, you are going to get into trouble. So you need to be very, very clear that before you go to a doctor to get a driving license, you need to have your blood group certificate along with you, so that it is appropriately entered in the form that is being provided by the Government of India.
Next one, pre-employment fitness certificate.
You need to assess whether the person is going to be a manual labor wherever he works, or he is going to be on a shift duty, or he is going to be using his brains like the IT industry or whatever it is. If it is going to manual labor, you need to check out his muscle mass, his ability to work for hours together, and if he is going to, whether he is suffering from a non-communicable disease or not. If that is going to be there has to be certain amount of restrictions for him. Depending on that, you need to advise them and then provide a fitness certificate. And if they can't do a shift duty, like that they're taking on an anti-epileptic drugs, or they are on too many drugs for them to maintain their normal life, I think shift duty should not be there. You cannot provide them a fitness certificate when they are applying for a shift duty. Whenever somebody is asking for a fitness for employment, demand the letter that is being asked by the company or the employer, because you will not know who is asking them, but you may know the company has got a shift duty. In that situation, demand the letter of offer that is being given to the individual, whether it is going to be a regular duty or a shift duty. And similarly, somebody who is unfit for a night shift, you can clearly mention that the individual cannot do night shifts. This has to be taken care, and this is there. You are trying to do something good for the individual also. Don't try to think that you are trying to provide him an employment of that nature. A poor cardiac reserve, you have a very poor ejection fraction. Somebody who has got a valvular disease, which is not common nowadays, but earlier it was there quite prevalent. You have a valvular disease with poor ejection fraction. An epileptic, a psychiatric illness, on long-term medications, on several medications. These are people who has to be really assessed well before they have been provided certificate, that too particularly when they are trying to use their brains for long hours sitting and working. You have a cervical spondylosis person, you have an ankylosing spondylitis patient, and they are going to sit hours together in a shift duty. And also the travel that involves from his place of work to his residence is also has to be taken considered. You please advise them to get a residence near the place of work, so that they walk there to that place and all these things. Rheumatoid arthritis patients working for long hours, cervical spondylosis, working with the brachial neuralgia, all these things also will have to be assessed.
Okay, the next one is fitness certificate for food handlers.
That's a very important one. Somebody who has got an infectious disease, somebody who has got tuberculosis, somebody who's a carrier of salmonella. Food handlers will have to have a proper, neat and hygienic physique. Even if his physique otherwise, at least his limbs has to be very clean and neat. And if he has got any infection in the limbs, or if he has got an infection in his respiratory tract or in his oral cavity, it has to be taken care before he is being given a fitness to work as a food handler. That has to be taken care, because by the way of his aerosol, by the way of his speech, by the way of handling food, he can spread the infection to other people, and that has to be very, very careful. Food handlers has to be given very thoughtful examination, or you might have to do some blood evaluation before giving them a fitness certificate, so that it's a very, very sensitive area where you are preventing the infection from spreading from one person to another person in the society.
So do you think you have to give them deworming before giving food handlers, certificate to the food handlers?
Yes, of course, that will be a good protocol, a standard protocol. You may not know whether he has got a pet at home. That's a very important when you're trying to give a certificate for somebody who's handling food. You need to ask them whether he has got a pet at home. It's not the pet alone. Maybe they have birds and all these things. They live along with it. They have been living with it. If they are so, I think it is better that you examine the respiratory tract, give a clear-cut standard protocol of anti-deworming, and then ask them to get the certificate from you.
So next one is school yearly certificates. Parents used to come to doctors for yearly fitness certificate for the children.
certificate. There are some schools which demand the fitness certificate. Probably they are trying to be very, very defensive in their in their system. That they
Handing
want a
over the
certificate.
responsibility to
Like what you said, handing over the responsibility to the parents and to the doctor who takes care of their family. That the child is fine and good. Anytime, any problem can happen at any part of time in their life. But then at that point of time, the patient was sick, and that is why we always say when you're trying to give a certificate, the component what you asked earlier, that at that point of time, the child was clinically normal. That is why date, time is all important for that.
And next one is, recently the students used to come to doctors for certificates before going to tournament or some joining NCC, something like that. So what thing we should consider before?
That's a physical fitness. Age, what we have said earlier about going for a sports event, whether the person is 16 years and above, 14 years or above, that has to be there. And physical fitness again. There are times when the child joining the NCC or the scouts in the school, that they for the first time find out that he has got a hole in the heart. He might go for a parade, feel dizzy, fall down, then come to a doctor, they examine and find it out. That is how the system probably came into existence, that before you join the NCC or scouts, that they need to get a medical certificate. There are times when a doctor, in spite of good auscultation, will not be able to pick up. A small murmur can always not be heard all the time. It may be heard only when the patient has got a tachycardia or something, and the heart rate is high. At that point of time, they can detect it. But there are times when the murmurs get masked. That will be the time that you can always miss it. So better try to examine appropriately. Tell the entire exam, a physical examination is very important before you give a certificate for joining any physical and manual hard work for any child.
And it's better
And
to
you also assess the anemic status of the child.
Yes,
the girl children must be seen and screened for an anemia as far as possible.
Next one is disability certificates.
Disability certificate can be given only by that specialist. If it is going to be an orthopedic, only an orthopedic. Only if it is going to be an eye, it is going to be an ophthalmologist. If it is going to be any injury on the face, scar on the face, it has to be only by a plastic surgeon. Disability certificate has got two major components in it. It has to be given only by that specialty, and you are not supposed to charge for that certificate. These are two major things that is there in giving a disability certificate.
The next one is death certificate for home death.
Home death, I think today people are smart enough asking the doctor nearby to visit the person when they are alive, and then finally it's in form 4A, death at home, that has to be provided there. You are obliged to give it if you have treated the patient in the previous 7 days or 14 days until 14 days, and the event of death is according to the ailment that the person is suffering. Most often the 80 plus, you don't need to give a certificate. It is the duty of the village VAOs to provide it, getting a 10 people's signature and give it, but that doesn't happen anymore.
Yeah, it does happen.
It doesn't happen. 80 years plus VAO certificate is adequate, but then they always come to the doctor. There are times when medical councils have received complaints against doctors for having been part of a homicide that has happened at home with 80 plus. Murdering. Somebody does it. They come and say the patient died of respiratory distress, and you really think that was the event that has happened and had given a certificate. But finally, one other child would have given a complaint, and then they would have found out that the old man or the old woman had been smothered and dead, and you had given a certificate accidentally trusting the family that land up with the trouble. There are a number of cases of that instance that has happened in this country.
How to avoid that?
Be careful about it. You better go see the event that has happened. See whether there is any mark or anywhere and how the people react. Somebody who tries to cheat you or somebody who tries to mislead you always will leave a proof somewhere else. Look out for it. Be suspicious. Don't trust people at all the time, and that too when there is going to be a death in old age and also death at young age. Two things that has to be very carefully handled. It is always ideal to call all the children, ask them, or try to get a letter from them. We are convinced that the death has happened on this date of time and this place, and we are convinced it is a natural death. You can demand that letter from all the children if you are sure about the number of kids, children are there for that, legal hires are there. You can get a letter, official letter from them, and then provide them the death certificate really for their old age person. And when you are trying to give for a young person, be very, very careful. And that too newly married within the 8 years period, when the husband or the spouse or whoever it is can be taken to task legally. Dowry harassment, physical violence, domestic violence can always be there. And be careful when you are trying to give a death certificate for one young person.
The next one is life certificate. You already mentioned that, but can ascertain it again.
Life certificate, assenter the person is that person. Always the company gives a form with the name always already written on it. Assenter, and today you have the other card to assenter whether the person is so and so. And make sure if you are trying, the person is not able to come to your clinic, make sure you go to their place and see. If it is not possible, at least on a virtual call, or your paramedical staffs can always go visit and finally find it out and give a video call and then talk to the person and then give a life certificate. It's very important that the person is alive on the day, and when you are trying to give a life certificate, make sure the time that the certificate is issued, the next 10 minutes, the next 10 hours, anything can happen for an old age person.
Next thing, the number of days. In leave certificates, is there any restriction for the number of days, maximum number of days for a doctor to give?
28 days, that's 4
days.
weeks. 28. Beyond 28 days, I think you have to reassess, or you can have to send to the board of medical examiners to get a certificate. Beyond 28 days.
Board of medical examiners meaning in the company?
In either the company has a board of examiners, or it has to go to a government hospital. They can apply to a government hospital. They want certificate for more than 28 days for an ailment, for a difficulty. Somebody is in coma. They say he might recover after 6 months. Then they have to go to a medical board. Medical board, get it ascenter, and then they will give a certificate that the person can be provided with another 3 months or 8 weeks or 12 weeks of leave available depending on his recovery.
I actually came across some situations like one woman recently got pregnant, and she's working in IT industry. She's asking for certificate because that is her precious conception. She needs rest, so she cannot travel frequently. So she asked me for a certificate for 6 months. Is that possible to give a certificate like
it's
that?
It's a duty of the obstetrician who has taken care of her to provide that certificate. She only will know it's a precious child. She only know it is going to be a tough tiding over the nine months or whatever it is. She is one who is obliged to give that leave certificate for that pregnant woman. As a family physician or a practitioner, we are not obliged, and our certificate will not have that value. Maybe the company might take it easily, but if that has to be very precise, it is the obstetrician's role to provide that certificate.
And another thing, if a patient comes with discharge summary and all the treatment details, and he's treated by some other hospital or some other doctor, can another doctor give certificate for that patient?
Yes, of course. Assessing the whole situation. Somebody who has been treated elsewhere, it's in the both situation, going back to work on a death certificate. Though you have not treated, but the sequence of event, maybe if you have seen the patient 7 days or 14 days, or they have come to you for consultation, then you can give the death certificate. Going back to work. All corporate hospitals may be in a different place, tier 2, tier 3 cities. In a tier 3 city, you would have gone to the tier 1 city to get a treatment, come back to tier 3. For getting back a fitness certificate, you may find it difficult to go back to the corporate hospital, the tier 1 city. In that situation, I think you assented the patient whether he is fit, recovered, he has got a discharge summary, the treatment provided to him, and the treatment he is on. You just try to assent whether the patient is really fit enough to go back to work, both mentally and physically, and then give them a certificate. There is no harm, and there is nothing legally preventing that individual to assenter the patient whether he is fit and give a certificate.
In your experience, do you think there are certain gaps, and what are the gaps exist in medical education regarding medico-legal aspects?
Whatever we have talked in the last 30 minutes had not been taught for us in our forensic medicine. Our forensic medicine teaches us mainly on injuries, violating the criminal law of the society and all these things. But these are soft law, like soft communicative skills. These are soft law in the society that a practitioner should also be taught about it. I think the curriculum will keep changing. You just think it positively. The experience that we've gone through, our inputs to the concerned person, we'll always try to provide them. Though the National Medical Commission or the previous MCA has given certain appendix in their own thing of trying to giving a certificate, discharge summary or not, all these things. There are so many things that keep coming up in the society. When they thought about it, there was nothing about the working at home, all these things. COVID created the whole scenario of working at home, people demanding to stay back at home. There are times when people demanding to go back to work. Somebody is not allowing from doing work from home, somebody is disturbing you at home, they can't perform properly, they want to go back to the work, and all these things are there. Certificates, demands of the individual, demands of the citizens. I think the professional will have to keep changing. Change is one thing which doesn't get stopped. It keeps changing every point of time, and that change has to be adopted by our medical curriculum. I think they need to talk more, teach more, other than criminal law in the forensic medicine. There has to be a syllabus of communication to the society. The communication includes these kinds of documentation. Relationship in the society. These are two major things that has to be taught to the medical.
I think, sir, in internship we should. I believe during internship all these things should be taught. Like, I think better they can have a subject for a theory class for interns regarding all how to survive in the society, how to be a relationship in the society. That has to be taught. Soft skills again. It's another soft skill that has to be inculcated as a curriculum in your house agency days. So finally, do you remember any interesting stories regarding the doctors given medical certificate inappropriately and got into problems? Do you remember any stories like that?
You are asking the right person to do this answer. I was the one who was also involved in giving a death certificate for an young person who had died due to a threatened abortion by a mother. They came and told that the girl died because she had a seizure and all these things. And when I went and saw, there was a scar mark on the forehead, and that's an young person, 18 years old, of college student, and she died, and I gave a certificate that the person has got a seizure and a subdural hemorrhage or whatever it is, but finally it turned out to be a forced abortion by the parent for having conceived in a college. There are so many things which cannot be told in the open, but then a post-mortem was done, revealed that the petechial hemorrhages in the spleen, liver, the entire vaginal canal was packed with cotton plugs, probably bled to death, and during the end of bleeding probably had a seizure, head injury and all these things. I have gone through the whole issue, and I was not being taught in my college all these things, or probably I have missed it in the college. But then it was a real miracle and a surprise that the police officer who investigated the whole case gave me a clean sheet, but you have been accidentally taken into this case. And I was one of the accused initially, but then I was a witness in the case. Yes, I was an accused in the case. And then finally I had been the witness in the case, and the case went in favor of the family or whatever it is at the end stage. There was nothing to prove. It was a forced one. It was something like that. But it was an experience, a very, very bitter experience to have gone through it. If it had not been for that police officer who investigated so thoroughly and interrogated me for several hours to find out the real truth, I would not be sitting here to give an interview with you.
Actually, what they are accused you of, sir?
I've been part of that whole episode of trying to do a illegal abortion, forced abortion, and the child died, and the girl child died. Naturally, this is why I said keep saying. You need to verify the individual, put down the identity mark, verify, go to the place and verify. That was the time when I went and saw. When I went and saw, already the girl was within the garlands, and everybody was there around the girl, and I could see a forehead scar, which prompted me to write it as a subdural hemorrhage. But that was not the truth. The body was exhumed, sent for post-mortem. They found it out, they packed cotton and all these things. It's an incident that has given me a lesson in my life, never to give a death certificate that easily. But then, and crossing over that trauma is very difficult, which should not happen to any medical practitioners.
Do you remember any other stories, sir, like from outside, like from other doctors? in your career?
Number of doctors had issued leave certificate and had landed up with problem with the companies. There are times when the medical commission has reprimanded them, called them and give them a warning, and there are times when there are doctors who had been banned or the temporary register number removed for 4 weeks and 6 weeks and all these things. There are quite a number of instances of that nature, and there are cases in the court giving a death certificate which was not a natural death. There's another incident, the family members himself involved. There was accusation, the court has intervened, a death certificate given, or having had taken a thumb impression when the person was lying in the bed in a hospital. They took the thumb impression. They said that the person was conscious, oriented and all these things, while the person was in hepatic encephalopathy, not knowing what is happening, but they took the thumb impression and the property was changed in the family members, and that resulted in a legal case, and finally the doctor had been suspended by the local medical council for almost a year. That's an incident that has happened.
Actually, what the doctor has done exactly, sir?
Used when the person was unconscious or an altered sensorium, lying in the ICU, they have taken a thumb impression of him in the documents.
Okay, sir. What is the role of doctor here, sir?
Person unconscious. Then while they gave a certificate, the person was conscious, oriented at the time when the thumb impression was taken. That is where the certificate is a fabricated or a false certificate attracting BNS 324 with imprisonment and fine also. There is another incident of a doctor involved in trying to remove the IV fluids that is going on for the old age person in an ICU, allowing the patient to collapse and die. These are two major incidents that will have to be seen in a very appropriate way. Though the second incident
looks like criminal.
Yes, the second case doesn't look like any certification involved. It was a criminal activity.
Yeah, okay.
In a hospital, the misuse of his position as a doctor, they gone near the doctor and tried to remove the IV line that was going is a resuscitation. One. The earlier case was trying to use the thumb impression, which is a very, very common sequence we always see in a movie or whatever it is.
Thank you, sir. Thank you for sharing your valuable experience and information. I think it will be very helpful for our young doctors as well as medical students.
Thank you for the opportunity to share my experiences on the medico-legal issues of certifications in practice.